our guest today. Dr. Patrice Muhammad is a board-certified physician associate and doctor of integrative medicine with 29 years of experience in various fields of medicine, including but not limited to internal medicine, family medicine, emergency medicine, pediatrics, occupational medicine, correctional medicine, and hematology oncology, for which she was appointed the lead abstractor for the Quality Oncology Practice Initiative for the American Society of Clinical Oncology. She is a certified medical examiner for the Department of Transportation, Federal Motor Carrier Safety Administration. She also has experience in disaster preparedness training and received her certification from the World Health Organization and the United Nations Educational, Scientific, and Cultural Organization, UNESCO. She is the owner of Health at its Best, which provides telehealth consultation to offer natural healing therapies based on the fundamentals of whole food nutrition, there it is again, and healing herbal tonics. This combination serves as a healthy and safe option to the synthetic, toxic, and chemically based medications and treatments offered by traditional primary care providers. It has been her life's mission to help others acquire true and sustainable healing to one's fullest capacity. Dr. Muhammad's signature statement is, "You are living your best life when your mind and body are balanced and healthy." Dr. Muhammad works in partnership with Salam Community Wellness Center, a newly established holistic alternative medicine wellness center in the Woodlawn area on Chicago's Southeast Side, where they offer a wide range of services such as primary care, integrative medicine, mental health and case management, nutrition therapy, traditional Chinese medicine, acupressure, Reiki, deep breathing, meditation, yoga, nutrition response testing, music and sound therapy, and chromotherapy. Dr. Muhammad is currently the project head and lead author of a published prostate cancer research project. She is working with an investigational review board on prostate cancer to conduct further research to develop a definitive criteria for the diagnosis of prostate cancer, with the goal of minimizing the tremendous gap that exists in the overdiagnosis and overtreatment of prostate cancer in men of African descent, leading to premature death. Okay, that is our guest for today. What a beautiful, beautiful resume. I will now bring up our host, Abdul Hakim Muhammad. Welcome, sir. Welcome to the show this evening. We're happy to have you.
Warm welcome to you too, and to everybody who is joining us this wonderful Thursday evening. Well, we're not at school today. We're in university this evening, okay? So you've all treated yourself to a great opportunity to receive supreme information about a condition that really is ill affecting us as Black males more than any other male on the planet. And this is obviously not an accident, and it's not something we're here to discuss this evening just to take up all of our time as to why us, but it's with us now. So now we have to accept the challenge to defeat it, manage it, and do everything we can with it so that it does not, thoroughly impact and take over our lives. And what better person to have with us this evening other than Dr. Patrice, a sister I've been blessed to know for decades of time, and it's been an honor and a privilege to know my dear sister. So without further delay, she is in Chicago at the moment, I believe, and she's coming live to us in London. Those of you in Paris, those of you in different parts of the Caribbean, in Africa, and all over Europe. We have this session being translated live in various languages. So those of you who are here, if you have a male member of your family, you have a few minutes to send them a text, to send them a link, and to encourage them to come on live. And sisters, if you have men in your lives and you love, and sons and cousins and nephews and grandparents, this is a good time to have them on. This is probably one of the best gifts you will give them, the gift of knowledge. So let's not waste any time, thinking that we can acquire all the information this evening and then pass it on. Let your loved ones hear it directly from our doctor this evening. So get texting, get calling. We've got literally 30 seconds to get busy. So with that said, Dr. Patrice, it's indeed a privilege and an honor for us to have you representing this very important subject matter this evening. So those of you in the listening audience, our spiritual injection listening audience, please take your devices for a brief second off mute and receive our special guest, Dr. Patrice Muhammad. Welcome to Spiritual Injection, Dr. Patrice.
Welcome, sister.
Oh, thank you so much. I truly appreciate it. This is an honor and a privilege. It is all mine that I was invited to share with your audience. I thank you for inviting me, and you do such great work and have always been a good brother, a good person to lead this charge in the UK that we really need to educate our people, and you are immersed in the community doing just that. And this show is an excellent way to reach many, many people that we would otherwise miss to come into a particular place or facility to receive the information. So again, thank you, thank you, thank you. Today, I want to share as you stated, the prostate cancer diagnosis is overwhelming in the Black community. And it is just, it's really, I don't want to go too much into it, but it is definitely a travesty. It's a travesty in our communities that our Black men are experiencing this disease disproportionately to any other man on the planet. And of course, we know it's by design. However, I'd like to give some information that has been documented, because you will have the naysayers that may not believe that it is such a disproportionate disease with Black men, and it is. I help lead a investigational review board where we have reviewed thousands of data and documents regarding this. So my purpose today is not only to educate and give information on what is in our communities, but also give some remedies to how our communities can lower this disproportionate diagnosis, and to actually put the test to the medical providers who are diagnosing our Black men disproportionately. So first, it has been determined by researchers that I'll just put this one researcher in particular at Johns Hopkins. He was a researcher, a scientist at Johns Hopkins, and he was asked the question, what is the cause of prostate cancer? Why is there such a disproportionate diagnosis of prostate cancer in Black men. And his response was, every Black male over the age of 60 has similar changes in their prostate. Every Black male after the age of 60 has these similar changes in the prostate. And some of these changes are diagnosed as cancer in some environments, and some are diagnosed as a benign prostatic hypertrophy, which is BPH. So those problems and those issues it prevails with the male prostate. But why are some diagnosed with cancer and some are diagnosed with a benign condition? Well, we would have to know their motive for that. But one thing I will say to educate Black men is get a second, a third, a fourth opinion, because later down the road, if you go a couple of layers, you may not have a diagnosis of prostate cancer. Now, the current measures that they use are not the best measures. And it's based upon the experience of the urologist, of the oncologist. So I just want to read a statement from the prostate cancer research study that we completed, which states the ambiguity of diagnosis of prostate cancer. The thesis statement states, and I won't read the entire thing, but there had been a well-documented men of African descent that are diagnosed with advanced stage prostate cancer and disproportionately die from the treatment. The prevalence of prostate cancer diagnosis among men of African American descent has caused much concern for the researchers of the Investigational Review Board. So we reviewed, as I said before, we reviewed different databases. Now, this is from the medical society. These were their studies, their statistics from PubMed, Medline, Google Scholar, Springer, Science Direct, the CDC, Cancer.org, and the American Urological Association. And these articles, we went from 1993 to 2002. And all articles were research for prostate cancer diagnosis. What is the gold standard for prostate cancer diagnosis? These were all searches that we put in the databases so we can get as much information as how is a person diagnosed, how is a Black male diagnosed with prostate cancer, or any male for that matter. What's the diagnosis criteria? So the goal of the project was to discover a set of protocols employed by oncologists, urologists, radiologists that distinctly points out and makes clear the metrics, tools, and processes to diagnose prostate cancer and gain relevant information to significantly reduce the incidence and death of prostate cancer. And based upon our investigation, we were not successful in locating a definitive diagnostic criteria for prostate cancer. Well, what does that mean? That means that no two urologists or oncologists diagnose prostate cancer in the same manner. Now, I know that may come as a shock because I know that people believe that it is just as cut and dry, that we have a criteria, we know what we're looking for. When that particular cell turnover or abnormality of the prostate is seen. It's definitive. We go to a biopsy and yes, you have cancer. Well, no, our studies revealed and our data, the data that we scan does not reveal that. It's not as simple as that. So therefore, after uncovering this critical discovery, it's imperative that we conduct further research. We develop a definitive criteria ourselves among our scientists to establish this criteria for diagnosis of prostate cancer so we can minimize the gap, tremendous gap that exists in the overdiagnosis and overtreatment of prostate cancer in men of African descent. Now, the testing that was developed by Dr. Richard Ablin, who was an immunologist, this was the prostate-specific antigen test that every male is encouraged to get every year. And this was discovered in 1970, but it was developed as a marker for a surveillance for recurrence of prostate cancer. He has been frustrated. Now I'm talking about the developer of the test has been frustrated that the PSA has been so widely used for diagnosis of prostate cancer. And he states in his words, the test is hardly more effective than a coin toss. PSA testing can't detect prostate cancer, and more important, it can't distinguish between the two types of prostate cancer, the one that will kill you and the one that won't. So with that being said, and we have it available, we have the testing available, we have the results available for anyone who would like to request it. My contact information will be given at the end of the show, and you can request our data and our findings, and more importantly, you can contact us if you've had a diagnosis of prostate cancer, and we can look further into this and get you for a second opinion, a third opinion, a fourth opinion. And also where I specifically come in is I can help with the diet that can help to restore the prostate back to its natural state of healing and remove the inflammatory markers that every male over 60 seems to have. And it's not all cancer. So I'll just stop there. And I don't know if we can take questions now or if you want
we
to go
definitely
into
going to take
okay.
questions. And before we take questions, we're going to have conversation.
Yes, sir. Yes, sir. Absolutely.
Because it seems as if then, Dr. Patrice, there is a massive conspiracy to frighten the hell out of us as Black men. And the last thing anybody wants to hear when they go to a doctor is that they have cancer, because just the announcement of such a name, just the sound of the word brings anxiety and stress. So this level of anxiety and this level of stress, do you think that the misdiagnosis is one thing? And secondly, the consequences of the stress that comes with misdiagnosis, can that actually lead to the condition, the stress factors?
Absolutely. And you already know, because you asked the question in such a way that you do know. When we internalize, whether it's a diagnosis or someone projects their own opinions about us and we internalize that, that is real. That is absolutely real. Thought travels at 24 billion miles a second. Right. So if we get that thought and we internalize it and say, oh, I have cancer, and your thought process is worrying you, that's diminishing. Let's just say you have an abnormal cell turnover. That's not cancer. It's just a little abnormal cell turnover, just a little bit of a tweaking of the cell that got a little, it got a little off track. But now you, with your worrying, have diminished, have suppressed the normal functioning of your immune system. The immune system cannot function properly. It cannot upload all of its defenders under stress. It is actually suppressed under stressful or chronic stressful situations. That's why you hear, oh, I'm stressed out. And people who have herpes, or who have, it doesn't have to be the genital herpes, but if you have just the herpes 1, which is when you get a cold sore, or if you get shingles, they say, oh, I'm stressed out. Well, what happens? That lowers your immune system and allows that viral activity to sprout up, to become active. So yes, thinking negatively, being worried, that is the least thing you want to do. I do understand and know that a diagnosis of cancer, we have been made to think that it's a death sentence, be afraid of it. No, there are many, 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 many people that are diagnosed with cancer of one form or another who are living today because they did not do what was intended for them to do, is become worried, put their life in the hands of this practitioner who gives them all types of toxic therapies, and now that person is no longer here. So yes, extremely important to reshape the mind, reshape the thinking, because you can live to overcome cancer. I know it for a fact. My mother is a living witness, diagnosed with multiple myeloma in 2017, which is a form of a blood cancer, and most people don't live very long with that. She is 6 years. She's 6 years in remission, and we intend for her to continue on as long as God has her to be here. So I'm a living witness to know that you can live with a cancer diagnosis and overcome it, and have had patience to overcome it.
And there's a scripture in the Bible that backs up what you're saying is, as a man, as a woman thinketh, so are they. So if we think sick, think diseased, then obviously we are that, right?
Absolutely.
Now let's look at an enlarged prostate.
Mm-hmm.
So the prostate can be inflamed, as you alluded to earlier, wherein a man's daily routine is interrupted by this enlargement, and the urethra, wherein the blood will flow or the water passes through, can contract and cause the male to urinate infrequently and have all types of complications attached to that. Speak us through an enlarged prostate and how natural that is, and what we can do to minimize such effects when they start to occur.
Yes, thank you. Well, that enlargement is actually an inflammatory response to the prostate. So what we need to do is prevent the inflammatory response from occurring as much as possible, which is difficult when you have the westernized diet. In particular, the westernized diet, it actually promotes inflammation. It promotes the environment for cancer. So one thing that we can do, even if you already have an enlarged prostate causing you to urinate frequently, or sometimes it causes infrequent urination, there are some foods that have been identified, and some actual studies, matter of fact, strong evidence in many studies, that by increasing an intake of anti-inflammatory foods and antioxidants, you can keep your prostate healthy and actually diminish the inflammatory process that has begun in the prostate. Now, there are 5 foods in particular that help diminish inflammation of the prostate, or it actually helps prevent the inflammatory response from occurring in the first place. Those are the cruciferous vegetables. Cruciferous vegetables like cabbage, bok choy, cauliflower, Brussels sprouts. Those are high in the antioxidants and the minerals and the
Dr.
phytochemicals.
Patrice,
Yes, sir.
you know the brothers are gonna say, we don't like those foods. I don't like it. I want
Yes, sir.
Nando's.
Yes, yes, sir. Yes, sir. Well, actually,
So talk to me also about
yes,
the transitions, because most of us have been reared from we were babies on oil and grease,
yes,
and
yes,
so to make that transition from
yes.
the type of diets that we have to the wonderful foods that you mentioned, can you also segue into the importance of retraining our palates, right?
Yes. Well, that is a very real, that's a reality. So when I get someone that comes in and you have to kind of retrain them, one thing that I ask is there anything bothering you right now? Or is there, obviously they're there to see me. So when I look into people who have diets that's been poor for many years, I do ask them, is there anything you can improve upon your diet? And most times, matter of fact, I haven't gotten one no yet.
Right.
So then at that point, they have to be open. And then I ask them, well, is there some things that you know that you can change and do better for your diet? I'm not trying to do a total makeover in one day. I tell them that. But I say, is there one thing that you think that you can do to really improve your diet and that you think would cause you to be healthier? And that's the way I kind of win them over. And yes, you have to meet people where they are. And if they tell you, well, yeah, you know what, I could drink a little bit more water. I don't drink enough water. Okay, I start there. Okay, and then sometimes people say I can eat a little bit more vegetables, or maybe I can have me some fruit. I let them tell me what is immediately on their mind for change. And most people, again, I haven't gotten one yet that didn't give me anything that they could do to improve their diet. So yes, I can start there. And then I can offer, especially if it's a male for prostate health that comes into the office. Once they give me what they know they can change, and most times they come in with information on what they've seen will help. So I'll start with that one thing. And then I may say, well, do you like berries? Okay, they may not want to start with the cruciferous vegetables. Okay, do you like berries? Most people eat berries. You like fish? You eat fish? What about tomatoes? Would you like some green tea? You want to have a cup of green tea a couple times a week? See, those are things that we can average in and diminish sugar. Sugar is one of the most potent foods that promote inflammation. One of the most influential foods that promote inflammation and give rise with other factors to cancer.
Is that in all of its form, whether it be raw or whether it be, white sugar, refined sugar? Does it matter?
Okay, so thank you for that. Refined sugar in particular. However, if the person has been diagnosed with cancer, then we need to remove as much sugar from every food, whether it's raw or honey. We have to start going to the glycemic index, which puts stevia or monk fruit, if they have to have something sweet, besides some of the fruits. You can have some of the fruits that are below 50 on the glycemic index. Maybe we can have a conversation with that on another show. But right. If you research glycemic index, that is a good measure to diminish the amount of sugar or glucose that's being produced from foods. So, but initially, yes, the processed sugar in particular is what I'm speaking of.
Okay, so if you can continue with your list that you were mentioning, sister, in regards to preventative, But where your list is concerned, and just I just want to cap off with the sweetener before you go back to the list and the lifestyle.
Okay.
What about what is that sweetener called? It's called
Agave?
agave. Is
Yeah.
that exempt?
No, it's not exempt. Agave, like a lot of things that, get this, they become in vogue. It has some benefit, but it's higher on the glycemic index. So if someone is really watching their sugar intake, if you have pre-diabetes or diabetes or been diagnosed with cancer, then agave is off the table,
Right.
So yeah, that's kind of where it fits.
Okay. Okay. So in regards to these preventative foods that will help or help us to avoid the condition or reduce an enlarged prostate, you mentioned the greens mainly and the vegetables. What else would you advise, Dr. Patrice?
Yes. So with the cruciferous vegetables, again, I mentioned berries because berries are very high in what's called antioxidants, and they help to destroy those free radicals that we've heard. And basically, free radicals are just the little abnormal substances that get into our blood and get into the extracellular space, and they wreak havoc. They're just like toxic byproducts. When food is broken down, they're just the toxic byproducts. Okay, so berries, all the berries, they can be tolerated even with prediabetes, diabetes, cancer. All the berries are low on the glycemic index, and they are powerful antioxidants. Fish, cold water fish, like salmon, sardines, and trout, they all have like the good fats, that really, they don't really trigger inflammation like the animal fat diet does. So those, there was a study that showed that those participants who substituted vegetable fat or fat from like the cold water fish, that actually reduced and lower the risk of dying from cancer. So replace the animal fat with the healthier fats. And again, fish is very good. And fish is also good for brain health, very good for brain health, okay? Tomatoes, that has long been put into the general public, that tomatoes actually have lycopene, which is a powerful antioxidant. And by cooking your tomatoes, you can really help to lower the inflammatory response, the inflammation and swelling of the prostate. And green tea that I mentioned, it's a really good source of, again, antioxidants, protecting you from the abnormal cell, the toxic byproducts that attacks the cells. Green tea, very, very good. And some people, even coffee, they're looking at coffee is a little bit more promising. I know it gets a really bad rap, but it's an herb. So just drinking coffee can help decrease the inflammatory response. And they say in the studies, there are just a few studies that say it may actually help prevent prostate cancer. So we'll see, but
that's without all of the sugar and the cream, right?
Right. Absolutely. There you have it. Yeah, because the sugar makes it, oh my goodness, it does. It promotes the inflammatory response.
Right. And one of the things I noticed, Dr. Patrice, whenever I would travel, particularly if you walk through business class, you'd always see those in there. Whenever the cart would go past, many men would be asking for tomato juice with Tabasco sauce. And I used to think, how gross, how gross. Yeah. But now I see the value in drinking tomato juice. Now, speak a little about that. Why is it that many have been drinking it, but in our community is considered, a no-go area or a no-go drink?
I don't know about because most of the environments where I go, which obviously aren't in the environments where you are. You have men that they have brought me that. And of course, I've been knowing about, tomato juice and tomato paste and that for years, for
Right.
many, many years for the prostate. And most men, when they come to me, they say, hey, I read about the tomatoes. Is that true? Is that true? And so I tell them, yes, there's been some studies that support that it is a powerful antioxidant and it helps protect against prostate cancer. So, but I don't know about the Tabasco sauce in particular. I'm not sure where that role comes in at, but I do know about the tomato juice. And
So
tomatoes.
tell us about, because it seems as if, many of us, we just have a lifestyle of death, right? Like it just lends itself to disease and sickness and ill health, right? And most of the things we like is just so bad for us, but we love it. Like we love it. So speak to me about a healthy lifestyle. What would a healthy lifestyle, like, you're looking after me, I'm your patient. What would you advise, Brother Hakeem? You're doing okay at the moment, but to maintain a healthy lifestyle, how many times a week do I need to exercise, Dr. Patrice? What kind of exercise do I need to engage in? And how do I keep my weight down? Because, being overweight may help to cause these kinds of illnesses. What do I need to do? What's the bespoke structure that can be translated across the spectrum where we are concerned as Black men, where we would be safe?
Yes. Well, that's a loaded question and an excellent one.
Thank you.
And I have a few recommendations and guidelines. And I would start first with lowering stress, lower your stress level. Because, and that, some of the chronic stress is a killer in and of itself. And it will worsen, exacerbate any illness or any disease that's lying under the surface that you're keeping, suppressed. Stress.
Wow.
Because you can have the best diets that I'll recommend that your viewing audience or listening audience get, How to Eat to Live, because that is being proven. That's by the Most Honorable Elijah Muhammad. Now that is being proven across the world as fact and as valuable, but they name it, they say OMAD, which is 1 meal a day. And they also describe it as intermittent fasting.
Right.
That's exactly what that is. So that can be proven. However, if you're eating a good diet, if you're exercising, just walking, you don't have to necessarily engage in weight training or, of course, the high intensity interval training is a big one, because you don't have to just, you don't have to run, you don't have to, now lifting weights, that's good, but walking regularly will help to condition the heart, strengthen the heart, strengthen your limbs, your extremities, give you muscle tone, walking. But we can walk, we can have the best foods, we can do more of a vegetarian diet or lifestyle, which is healthier than, of course, a meat lifestyle or fish. But again, vegetarian is the best. If we could really stay on a vegetarian diet, that will lower and diminish the inflammatory response that the body has tremendously. But we could do all of these things, but I talk about the mind. We started off talking about the mind. If you're stressed and chronically stressed, it can undo your efforts. So there has to be a mechanism to diminish your stress level in your healthy lifestyle. You cannot have a healthy lifestyle if you're stressed, if the mind is not at rest. In that book, it talks about what hurts one hurts the other. So you have to have good thoughts here, along with good food to make a healthy body.
Right. So we need to then eliminate people out of our lives, then it would seem, who cause us stress, right?
Eliminate or see if you can get them on board with you somehow, because some people can eliminate their wife or their husband, you know, or their significant other like
that's
that.
a little more difficult.
But a job, I've consulted people say you have to, let's start working towards getting you off the job because the job is killing you, literally.
Right. So just a couple more questions. I know Sister Sylvina, Sister Tara wants to jump in real quick. Sure. But by way of these types of choices, because it seems as if your friendship base, your work environment, and the type of relationships we have is what really is is at the root of giving rise to what we would call prostate enlargement and prostate cancer. So choosing, mates and choosing somebody who because many of us, Dr. Patrice, say, oh, I love you, and don't care about what the person you say you love eats. Don't care whether the person who you say you love exercises.
Come on.
They have no interest in the person's, curtailing these bad habits, but we love them to death, it would seem. So how can we reverse loving people to death to loving them to life?
Yes, sir. Well, this is one means. By getting and surrounding yourself in the community with information like this, that puts in the forefront the importance of loving someone to life. Because unless you can curtail, diminish those stress factors, whether it's relationship, job, what profession, whatever it is, unless you can curtail that, that is going to be a major influence on your life. And we have to get into those, we have to immerse ourselves in the communities. We have to educate. This is a format, but there are other formats. Be as visible as possible to share that information, especially in our communities. We must ban on and have more that give the information that you're giving on your program.
Fantastic. So Sister Sylvina, Sister Tara, we need to get rid of people we don't like.
I knew that years ago.
We need to reduce our stress. What do you think? Or who don't like us? Because it works both ways, right? So we need to make a list of people who don't like us and people who we don't like so much. And then, we can move towards good health, it would seem. So did you have any questions for Dr. Patrice as we're running so fast? Time is moving so quickly.
Yes, I have one question. Besides frequent or infrequent urination, what are some symptoms that could, alert someone to a prostate issue?
Sometimes there's a little blood in the urine. The person can, have blood in the urine, recurrent urinary tract infections. Men aren't really supposed to get urinary tract infections because of the distance of the urethra. It has a long way to travel, the bacteria and urine out, versus women. The urethra is very close to the vaginal area and opening. So recurrent urinary tract infections is a big one. That's how most men find out, or something's going on with the prostate. I'm having this residual urine. Sometimes they're going often because it's the urine is not being emptied completely because of the tension around the urethra from the prostate. And again, I said they can have bloody urine also. And then sometimes you can have this little pain down in the lower part of the abdomen. That can also let you know. And if you notice the bulge, it doesn't necessarily have to be from just you gaining weight. But if that lower abdominal pain in the male occurs, sometimes it can represent a tumor also.
Okay, thank you.
Thank you. Dr. Patricia, you mentioned earlier the overdiagnosis and overtreatment of Black men. And it kind of got me thinking, it tends to happen a lot, you know, mental health. It got me thinking of that. But I just wanted to, you also mentioned as well, which contradicted, which I'm not saying it's not sound, I believe it's sound, you know, the PSA testing, that's, you know, as significant as a coin toss. So my question to you was, what does over-treatment look like? Because I'll tell you why I asked this. I came across, there's a public figure in the UK, and it makes perfect sense of what you were saying. And he said that his PSA testing was high. And the doctor said to him to watch it, you know what, it went back a year later, a bit higher. Yes, okay, it looks like you've got a cancer, but we're not going to treat you yet. And I'm just wondering, how can you make sense of that for me in line with what you mentioned about the overdiagnosis and overtreatment, please?
Well, you're in the UK, I'm assuming.
Yes.
And I'm in the US.
Yes.
So overdiagnosis and overtreatment is the order of the day here.
Right.
So overtreatment looks like a PSA. I'm talking about real patient. I do have, you know, real patients with prostate cancer, and I do have male patients.
Right.
But I'm talking about a patient with a PSA of 10.
Right.
Okay. And this patient is now being told that he possibly has cancer. He needs to get a biopsy and then on to treatment. Well, first of all, 10 may be what it could be, the level that your friend or the public figure you're talking about could be. I mean, because what is high, you know, over 4 is considered, you know, if it's over 4, oh, it's high, and they start monitoring. But some experienced, well-meaning urologists will just watch and wait for a 10. You do not have to go in and stick a needle in a prostate because it's a 10. So now we're over treating. Now we're over diagnosing, because a 10 is not something to be concerned about without other factors that may make you think or have a high index of suspicion that this person has cancer. 20, you know, 20 is, if you go and you get a PSA and it's 20, then most urologists here in the US are going to try to whisk you off to surgery. But that doesn't mean the person has cancer. So that's what overtreatment looks like. It looks like those who take numbers, which and only treat numbers. See, they're treating numbers. They're not treating a person. So I have a 10, or I need to whisk you off for a biopsy. And then depending on what it is, if there's any level of cellular dysfunction or abnormality, then they want to automatically say, okay, well, that's abnormal. We need to, you know, we need to go ahead and do a prostatectomy, which is removing the prostate, or we need to give you radiation. You know, we go this proton beam therapy that they've come out with. All of this was on the backs of these high PSAs that they were just cranking out like a warehouse.
Right. So can I ask, just thank you for that, Dr. Patricia, as a follow-up question. So with regards to you mentioned about the overdiagnosis. My question was to do with, because you mentioned earlier that no two practitioners have one way of diagnosing the prostate cancer, which makes perfect sense of what you're saying. So what further tests could be done, if any, to kind of corroborate and say, okay, then 20 for you, this maybe is pointing to cancer for you?
Oh, that's an excellent question. I'm glad we'll get to address that before we before we leave, because
Okay.
that's important. I stated in the study at the conclusion that we have to develop diagnostic factors for, or criteria for prostate cancer.
Yeah.
So there are several studies that of diagnostic tests that are on the horizon, but they will not approve them to be given in the mainstream community, like a PCA3.
Okay.
That's one of the markers of tests. The PHI. Okay, so you have other tests that are
Right.
being developed, and diagnostic studies, which are non-invasive, so you don't have to stick a needle. They
Okay.
have a nuclear medicine test that they can have that's supposed to be highly sensitive and specific. These are the statistics terms of how you choose a test. Usually supposed to be, except again, the PSA, it just totally, bypassed that.
Yeah.
But
Right.
there are some studies, but they won't allow those to be given in the public setting. They make it extremely expensive. And if you don't pay hundreds and hundreds of dollars out of pocket, then we don't want to use those tests. Well, why are they holding other tests that other scientists have developed to be more specific with the diagnostic criteria for prostate cancer? They're just holding it at bay.
Right.
So Dr. Patrice, just to follow on from that particular question, I just want to pivot a little bit. Just 3 quick questions, because I know your time is very limited. The first thing is, the way how the male excretes waste is different from the way how the female excretes waste. Should that be the same? Because Western way of excreting urine as the male is to stand, where your bowels are stressed, as opposed to seat in a sitting position where your whole bowel area is relaxed. So you will find, I don't want to get too technical, but you will find as a male, if a male stands, then his anal area will lock up. Where if he sits, all of his areas are open for whatever may flow, right? Do you think the hoarding of waste matter in these areas and not allowing yourself to, whenever you feel the urge to use the bathroom, you give yourself the option, for both levels of elimination? I know it may sound gross to some, but it's a very important question, because in the East, men, routinely sit when they're eliminating waste, regardless to whether it's urination or defecation. But in the West, it seems like, when a man is going to urinate, he stands. When he's defecating, he sits. For the sake of elimination, if you will, eliminating this being one of the causative factors, should the male naturally sit down to ease, these type of areas, to ensure that this is not causing stress in these areas?
Well, that is a very good observation, and I have not looked at it as such. So you're proposing that if there is a relaxation of the pelvic organs and the of the pelvis, versus standing at this tense position to urinate, is that putting increased or undue stress on the prostatic tissue, which is contributing to the inflammatory response?
Right.
Well, that's something to consider. That's possible.
Right.
That's all I can say is yes. I mean, that's possible.
Right. Because as a male,
sense,
we would definitely find that if we sit, that we would defecate more than we do. because we would defecate alongside urination, as opposed to just urinating and not giving yourself the option to empty your bowels. Like this is real. This happens, you know. So be that as it may, I honestly do believe that this way of waste elimination has become a culture for us in the West, but it's not natural. It's not a natural way to release toxic chemicals within your body. And secondly, you do know whenever a person uses the restroom for defecation purposes, they're very clear that they have to clean themselves with soap and water, etc. But when a man urinates, that's not the case. You know, he would just urinate standing and he would just zip up and keep it moving. So be that as it may, you know, that area that might not be circumcised, Dr. Patrice, you know, has now had added bacteria to it. So could it be that we're not keeping ourselves as clean as we should be to minimize the level of disease, if you will, and bacteria in that area? That one, you know, we're standing, so we're not fully, what is the word I'm looking for? We're not fully relaxed. And two, when a male stands, he's gonna drip, okay? And and number three, it might be that he's not circumcised on top of it, okay? So where a man may be out all day working and you know, urinating 3-4 times a day, you know, in a dark, damp area, could it be that we are triggering this through lack of cleanliness? And fourth, you know, I was reading that there is chemicals in the toilet paper that we use that are very harmful on a cellular level. So just speak to me about some of those things real quick, and then we can wrap up.
Those are definitely aspects to consider when looking at causative factors of prostate cancer, or even just, you know, prostate abnormality. You know, every abnormality of the prostate is not cancer. So contributing to the inflammatory component that can possibly give rise to cancer, everything that you stated is and should be of consideration, because that makes sense. It makes sense that, and as a matter of fact, it is actually one of the factors that gives rise to cancer, and in some cases is the bacterial component that is a part and parcel of that inflammatory response. And then you have a bacterial cause of cancer also. So that's extremely important and should be considered as we're looking towards causative factors. And then once we, for better, I guess for better naming of what we can do, cleaning yourself, being more hygienic, because those environments that you just spoke about, that's a real component and can very well be mitigated as possible causative factors for prostate cancer.
Yes, ma'am. And lastly, because next week we're going to be discussing erectile dysfunctionality, which is a big thing in our community, but because we're very proud as Black men, that's the last thing we want to be labeled as, is erectile dysfunctional. So we're going to have a discussion next week, you know, on this subject matter. But tell me, is there any correlation between an oversized prostate and erectile dysfunctionality?
Well, yes, because if, you know, those vessels that hold the blood for an erection, they also get affected. And when you talk about inflammation, well, what's causing inflammation? Well, one of the components is cholesterol, some of the fats we take in, and sugar, diabetes, pre-diabetes. So these factors actually, they line the vessels that are supposed to have a good blood flow so that you can have an erection. If those vessels are the inside of the lumen that's supposed to hold blood, if the lumen, the opening is smaller because you have plaque and inflammation in those areas, you won't have a potent erection because there's already prevailing plaque within those arteries, within those vessels that are supposed to innervate the male penis for an erection.
So there is a connection there.
Yes.
Okay, so fantastic, Dr. Patrice. I really have enjoyed myself this Thursday evening, and I know you're on a deadline, but
that's okay. But you have some very thought-provoking comments.
Yes, ma'am. Please tell us, is there any closing remarks you would like to share with us? Because prostate cancer is the leading killer here in the UK, leading killer cancer here in the UK, particularly where we are concerned as Black men. But what advice would you give generally in your closing remarks?
The advice that I would give, number one, is if you get the diagnosis, please seek out a second, a third, a fourth opinion. I am available. I have colleagues that are like-minded that will take you through the process, through this quote unquote diagnosis. The thinking process is very, very important. Do not embrace or take in a cancer diagnosis as such. Please hear the information and then move, do something about it. And lastly, I really want more of us to come together for solutions so that we can get information out on a higher scale so we can affect more people with this information.
Okay, so just lastly, because there's a burning question, Dr. Patrice, in the chat in regards to the PSA testing. Is it the same globally, or is there a specific, does each country have its own derivative of the PSA?
Well, I'm not aware of a specific derivative, although it may exist because sometimes all countries don't share their medical information. It's almost like this is exclusivity in one part of the world to another. But globally, this PSA test has saturated the planet. However, I don't think that they have their own derivative. It's been the same PSA since 1970. However, there are some countries that think, like a lot of the scientists here, that we need to do something else outside of that. So I'm not aware, but if I find out that there is, I can research it, get it back to you, and next week you can impart the information if you can, but I'm not aware of another derivative for the UK versus Asia or any other of the other countries.
Fantastic. And lastly, Dr. Patrice, I remember I was in Chicago and I was in a line to get manually tested. And just the thought of this male manually, examining me, it sent chills down my spine. So suffice it to say, I got to the front of the queue and I turned back. I just couldn't bring myself to such. So the PSA was a great blessing because it's just a blood test, right? But would you recommend a manual test for the male to actually feel the prostate to see whether it is hard or whether it is moist? And I ended up getting it done eventually. I found myself a young Asian lady with very small fingers and she was able to help me with my anxiety.
Yes, yes.
Suffice it to say, but I couldn't have a male mess with me like that. I'm not saying it's a good thing. It's just the phobia that I had. So would you recommend, though, that that is something when you find the right person who can examine you like that, that is done in addition to the PSA? Or is it something we should outlaw?
Well, I don't, me personally, I don't endorse it because I know of course I'm not a male, but I can imagine what that makes a real male feel like when he has that done.
Right.
And if we can get around that, then definitely do so as you did. You didn't want another male, but you had a female who you knew that, that there's not any funny stuff going on. You had confidence and you trusted her. So on a case-by-case basis, I make my recommendations. I'll put it that way. I'm not across the board necessarily, although I do lean towards not having it done and having just the PSA just as an initial start. I don't hang my hat on that, but have your PSA. And if it's extremely high, like over 20, 30, and you're having some symptoms, then maybe you would want to have it done with a person whom you trust, a person who you feel comfortable with. But there are some other testing, Brother Hakeem, that they are very specific. It's very specific and sensitive for prostate cancer. It's a nuclear medicine test that you can have. You don't have to biopsy the prostate. You don't have to feel the prostate. It's a test that they have, but you hear about it. It's done, but they won't go any further with it. And I think that when I researched that, it was very promising. And I was hoping that we could get some developments on it, or to find out how those of us who are in the scientific or medical community could advocate to push this through, because I think that'll be a game changer. And many men like you do not want to have a digital, we call that the digital rectal exam. That is causing them not to be tested, period.
Right.
They just rather just not have it. So we have to have a way that we can encourage you to get tested, to take a look, and then we'll have the treatment for whatever we find. We'll develop a treatment plan specific to that male.
Fantastic. I wish I could have you for another hour. By the time I know it is what it is.
Yes,
you have a busy schedule.
Invite me back. I'm available to invite me back, and we can talk about this and other things. Yes, absolutely.
Fantastic. Thank you. So those of you in the listening audience, would you like us to invite Dr. Patrice back? Let me see some ones in the chat. Let me see some ones, because there's just no way we could cover this in one session. Just not possible. And we're going to, in the interim period, we're going to drop Dr. Patrice's information in the chat. I believe it's already there for you to contact Dr. Patrice, so that we can keep this very important conversation going and reduce the casualties of us as Black males, and the trauma that we suffer just by the statistics that we will all get it by we're 80. This is what I was reading, Dr. Patrice, that every last one of us by we're 80 will suffer from an enlarged prostate, or or lose our lives as a consequence of having some form of prostate cancer.
If there's not some intervention.
Yeah. So we thank you for the intervention and giving us the courage to not just take, somebody's opinion who might not necessarily have our best interest at heart, because this is our lives that we're speaking about, right? And we must be willing to do whatever is necessary in order to protect the most valuable entity that we have, which is our lives. So Dr. Patrice, We love you. We thank you. Continue
Love
with
you
the great
too.
work that you're doing. We look forward to having you back on the Spiritual
Thank
Injection.
you.
So those of you in our listening audience, this is the time you get your opportunity to show your appreciation by taking your device off of mute and clapping until your hands are red.
Oh, thank you.
Thank you so much.
Awesome.
That
Awesome.
was fantastic.
Awesome. Awesome, doctor. Awesome.
Wonderful.
Thank you, thank you,
Awesome,
thank
doctor.
you.
Thank you.